Okay. So chapter 3 is all about prefixes. Make it like a slideshow. Okay. And we'll do this. All right. So prefixes. Prefixes, it's a word element at the beginning of a word, and it can change the whole meaning of the word. Not all medical terms have prefixes. Most of the prefixes are the same as in the English language, like pre, right? Or post, they're very common ones. Prefixes can describe position of something. They can describe a number or a measurement of something, a direction of something, or there are some prefixes that are used to actually change the meaning of a word, okay? So when we're talking about a location, epigastric, we're talking about kind of around or right above the stomach. Intercostal, we're talking about in between, intercostal spaces in between the ribs. Prenatal, before you have the baby. Postnatal, after you have the baby. Subnasal, and sub is below, right? Below the nasal cavity. And then they can describe an amount, a size, or a degree of involvement. And a lot of these are in the English language, like poly means many, right? So if we say polyphobia, that's a shame. That guy's got a lot of phobias. Macro means large. So a macrocyte can be a red blood cell that's too large, or a microcyte, micro meaning small, can be one that's too small. Quadriplegia, so quadra meaning 4, that means that they are paralyzed in all 4 extremities. Triceps, tri means 3, so those are prefixes that talk about kind of, numbers. Then there are directional prefixes. They talk about kind of like a pathway to something or a route to something. So and it sounds like circle, right? So circumrenal, kind of around the kidneys. Extracranial, extra means outside of, right? Where intra means inside of, intramuscular. When we talk about paranasal, we're talking about kind of within the nasal. Supra is above, like suprarenal, above the kidneys. Endo means within, so endocrine. And then here they're used to change the meaning of a word. So if you have the word bacterial, but then you put anti in front of it, well, an antibacterial is something that fights or kills bacteria, right? Anesthesia. So when we think about anesthesia, we don't realize that that's actually a prefix. So anesthesia is without being awake, right? Amastia, whenever you see a or an in front of a word, that means kind of without, right? Eupnea, EU, we're usually talking about something that is normal or expected or within normal range. And then dyspnea, just remember dysfunctional family. DYS means there's a problem with it. There's something wrong. So dyspnea means they're having trouble breathing, all right? And then homograph, we're doing one, like homogeneous versus heterogeneous, homosexual versus heterosexual. So homo means, dealing with just one type of graft. So we're going to do the same thing this time. At the end, I'll let you guys do these exercises and we'll talk about them. Okay, so let me zip through them. And that's it. Wow. All right. So let me stop my share and stop.